Live from San Diego, this is the Fox 5 News at 1.
Well, scientists have found microplastics in just about every place that they've looked. That includes the ocean, the air, drinking water, even breast milk.
Yeah, disturbing. Joining us in studio now to talk a little bit more about this and, of course, how microplastics can impact your health is Fox 5 medical contributor Dr. Richard Chaffoo. Thanks for joining us today. We always enjoy seeing you.
Thank you.
Tell us, first of all, what microplastics are.
So Maria, microplastics are really tiny plastic particles or residues, as we said earlier, are ubiquitous throughout our environment. They're literally microscopic in nature. So, and the very smallest ones, the ones that we're concerned about in terms of health risks, are called nanoparticles. And these are literally the size of about 1 to 1,000th of a human hair. So obviously very tiny particles. And the problem with nanoparticles is they can travel throughout our body. They can get in the bloodstream, the lymph nodes, and they can be found in all different organs in the body. There is a study that was done not that long ago where they had pregnant rats, and they were ingesting these micro nanoparticles or inhaling them, and within 24 hours actually found them in the fetus. So we know that there's something that's very easy to get into our bodies.
So let's talk about, as far as what we know, how they end up there, you know, right? So
right.
We throw them in the landfill perhaps, and they break down. I mean, help us understand that process, and also something that small, how it can affect our health.
Sure. So Andrew, essentially what happens is that these really tiny particles, we can get them from all kinds of degradation of our plastic materials, even from some things like, for example, we have all these rubber tires, and the water runoff, the tires on the road, that gets into our water system. So we can it gets into our bodies from ingestion, from inhalation, and then once it gets into, for example, inhalation, we have these, millions of small vessels near our alveoli or air sacs, and it's essentially absorbed into the bloodstream and then can get into the air, various organs of the body where there's high blood flow, such as the heart, the kidneys, the brain, the liver, the lung. Those are areas where these nanoparticles can be found.
You know, a recent study found that in a liter of water, bottled water, it contained an average of 240,000 plastic particles from 7 types of plastics.
Exactly.
And 90% were those nanoplastics that we were talking about.
Yes.
I mean, how do they even do that?
So the problem with those really tiny particles, Maria, is that as you said, there are all kinds of plastics. We know that there are things like phenols, polyvinyl carbons, also phthalates, and these are thought to be endocrine disruptors. And a really interesting study came out relatively recently where they looked at over 250 people that underwent surgery for the carotid artery, called a carotid endarterectomy, where essentially surgeons go in, open the carotid because there's plaque, there's disease, and they remove this material or sludge, and they're looking at it microscopically, and what they found was that at least 58 to 60% of those samples that were obtained had these nanoparticles. And they followed those patients over a 3 to 4 year period, and they found that those people had at least a 2-fold increased risk of getting heart disease and having a stroke. What we think happens with these nanoparticles is they cause a low-level inflammation, and we do know, and researchers have found, that diseases that are related to the inflammatory process, like heart disease and cardiovascular disease and diseases of the central nervous system, like strokes, do have an inflammatory reaction. And so scientists think that perhaps it is these nanoparticles that stimulate the inflammatory process even more. But it's really important for the public to understand that really this is a small study on a small series, and so they caution us not to necessarily make a cause and effect relationship. Of course, we're concerned about it. More studies need to be done to really determine the cause.
It comes like more studies. If we look at what kind of things we're more vulnerable to these days, or maybe the obesity epidemic in America, whatever the case may be, are things attributable if you look back over the last, I don't know, 100, 150 years, or however long, probably not 150, but 100 years that this has been around?
Yeah, and I wouldn't be at all surprised. And you're right. These products are being brought into our lives, and we don't realize how much we're using this and what type of a health impact. I mean, besides the obvious plastic, we all know it's not exactly the best thing for the environment. It's not very biodegradable, and certainly we're seeing it's not biodegradable. The human can't biodegrade these particles either.
So what can we do, really? I mean,
so the best thing we can do is probably limit plastic exposure when possible, utilizing more I think we were saying earlier on, you like using more stainless steel, ceramic, versus plastic utensils. My wife's always reminding me, don't microwave something that's plastic. You don't want those little particles. If you're going to the grocery store, maybe getting paper versus plastic. If you're getting your clothes dry cleaned, maybe bringing a garment bag versus using the plastic there. But you're right, it's a problem that's just so ubiquitous, it's hard to really know. But limiting is probably the best till we know more.
Important stuff and a tough subject.
Yeah,
to really
for
understand.
sure.
It's so,
we've kind of done the damage already.
Yeah. All right, Dr. Chaffoo, thank you so much for the insight. We always appreciate it.
Sure.